name is Jason Taporco, and I'm a fourth-year medical student and Masters of Public Health student at the University of Kansas Medical Center. I'm thrilled to provide you this project overview on behalf of my other fourth-year colleagues, Elizabeth Wolf, Gabriela Chavez, Zev Allen, Jasmine Estrada, Kelly Thompson, Jennifer Metling, and our faculty advisor, Dr. Michael Kennedy. Kansas is a predominantly rural state and responsible for around 10,000 rural births each year. The Kansas Rural Obstetrical Access Task Force was formed to study and address factors affecting these births. One of those factors is the distance between mothers and the location of maternity services. It's been established that increased distance between pregnant mothers and maternity care providers leads to higher rates of pregnancy complications, premature births, and cost of care. Additionally, our state has had multiple hospital closures and practice changes that have led to narrowed access of care to obstetric services. This led us to believe that significant portions of our state had limited access to care and could be defined as maternity deserts, or entire counties without a single maternity care provider. However, it was unknown as to where obstetric providers are located, and therefore where the areas of poorest access were. This led to the purpose of this study, which was to identify who is delivering babies in Kansas, where are they located, and what their future plans are for providing maternity care. To begin, a map of Kansas was divided by its 105 relatively uniform counties. Due to the prevalence of maternity services in urban and suburban counties, those counties were excluded from this study. This left 89 frontier, rural, and densely settled rural counties. Through data from the Kansas Board of Healing Arts and cross-referencing with hospital records and birth certificate signers, we narrowed the specialties to family medicine, general practice, and OB-GYN to narrow our list to 430 possible providers. These providers filled out a 72-question survey that was designed by the Kansas Rural Obstetrical Access Task Force and revised through subsequent feedback. Of these, 117 reported that they provide maternity care services, and 83% of those fully completed the survey over one of the 3 years that it was administered. An effort was made to identify certified nurse midwives. However, there is no centralized database showing the practice location of certified nurse midwives. The questionnaire did ask respondents if they were aware of certified nurse midwives in their area, and only 2 reported active practice in their county. From this data, we answered our first question of who is delivering babies. We found that predominantly family medicine trained physicians are delivering babies in Kansas. There were no OB-GYN trained physicians currently delivering babies in rural Kansas. Next, from these results, we generated maps to identify where these practices were located. What we found was quite concerning. Shaded in red are the 57 of the 89 eligible counties that reported no active maternity care providers, and therefore could be classified as a maternity care desert. Shaded in gray are the 16 counties excluded from this study. This gave us clear evidence that numerous counties have severely limited access to care. This led to our third and final question: what are the future plans for providing maternity care? Also included in our 72-item survey were questions about longevity of practice, plans to retire, or plans to stop providing maternity care services due to another reason. In the short term, our survey showed the number of maternity deserts rising to 61 of the 89, and by 2030, a continued rise to 65 of the 89. However, this doesn't capture the important factor of sustainability. It's been studied that practices with 1 to 2 maternity care providers are unsustainable due to low volume of patients and high call load. Financial difficulties also aren't included. If this, as well as the average age of retirement in Kansas at the age of 67, are taken into account, we see a very grim worst-case scenario picture of 2030 at only 6 eligible counties not being classified as a maternity desert. With the 3 main questions of our study concluded, we now have a much more clear picture as to the distribution and projected expansion of maternity deserts in Kansas. The significant loss over the next 10 years poses a high risk and significant challenge to our state that is likely contributing to poorer maternal fetal outcomes. However, Because of this new information, we are able to more effectively and directly target and renew efforts towards incentivizing rural practice, following the development of evolving independent certified nurse midwife practice and exploring factors to improve sustainable practice in our state.